Senator Siewert.
Madam Acting Deputy President, while I tend to agree with the essence of this debate, and that is that the Gillard government's failure to properly fund mental health services, while I agree with the fact that we have not been funding our mental health services adequately enough, I can't support this particular motion because of the antics of the opposition. The opposition put a motion to this chamber about one specific aspect of mental health, not taking a comprehensive approach to addressing mental health. Now, as health spokesperson, I've been out, I've got a particular passion for issues around mental health, and having chaired the inquiry into suicide in Australia, it heightened my awareness around issues of mental health. I have been out and consulted widely. I understand that our mental health services are significantly underfunded in this country. This Senate has had 2 previous inquiries into mental health, and one of the findings of those inquiries was that we need to have around 10% of our health budget on expenditure on mental health. That in Australia at the moment puts us around behind in our investment of about $5 billion a year in mental health. Now, I'm a realist to know that we're not going to catch up with that investment of $5 billion overnight. And in fact, the Senate committee, when they reported on this, said that you need to phase that in over a sort of a 5-year period. Now, that hasn't happened. So we're having this debate in the context of we're significantly underfunding our mental health investment. One of the things that I've learnt many things in my consultation process, but one of those is the need for a comprehensive approach to dealing with mental health. And I've also learnt that early intervention is absolutely essential, that Headspace and EPIC centres, which are early intervention centres, are absolutely critical. And the Greens fully support those centres. But they are not the solution to everything. They are not the silver bullet that we've been looking for, because there are younger people, for example. Headspace really says they deal with people between the age of, say, 12 and 25. In reality, at the moment, it's probably 18 to 25. So for a start, we have that very early teenage years that need some support. Even into primary school, early high school years, we need to be investing there. And then, of course, there's a lot of people in Australia with mental health illnesses that are over the age of 25. And if we don't invest comprehensively, take a comprehensive approach, what you're saying is those people won't get any additional services when we know they're absolutely missing out. We know there's a full range, many Australians, I think it's 1 in 4 people with a mental illness get some sort of support. So what we're saying is those people don't deserve any additional funding. We know we need better primary care, healthcare services. We need better access to GPs for mental health. We absolutely know that when people go into an emergency department, they actually need to, with either having attempted suicide or threatening to attempt suicide, we know that when they go into emergency departments, they need to see someone with mental health expertise. We also know that in this country, very few emergency departments have somebody on call 24 hours a day with mental health experience. So quite often people are seen or held in the ED and then go home with being either not treated or inadequately treated, and we know people further attempt after that. So we know that we need to invest in that area. We know that people coming out of psychiatric care and having been admitted to hospital absolutely need follow-up, and we know that people aren't being followed up. We know that we need to invest there. We know that we need graded accommodation, step-up, step-down accommodation. We absolutely know that. We know that we need more mobile support services. We know we need to invest in dealing with mental health issues in Aboriginal communities, and that requires a significant level of investment. So what the Liberals did is they brought in a motion which they admit in this chamber that it was just their policy, and their policy was purely about, essentially purely about early intervention. So when the Greens asked for them to give us a costing on that so we could look at whether they intend spending virtually all the future investment in Headspace, we didn't receive that. When we asked to amend it, there was no agreement to amend it, and I was told in this chamber to go and look at the Liberal Party policy. So in other words, all the opposition were doing was trying to bulldoze through their policy instead of taking a much more cooperative approach to look at how we can seriously address mental health in this country. So instead of we could actually take a more cooperative approach in this place, which is what the Senate has been doing in the past. We have taken a cross-party approach to mental health, which has been demonstrated by the good work that has been done through the Senate committee process, but that's been thrown out to take a purely political approach so they can get a few, as Senator Moore was saying, a few photos on websites, a few media grabs around mental health, bash up the government, bash up the Greens, because we are taking a much more comprehensive approach. We have also taken, and we've also tried to amend and said we are prepared, and we have altered our approach. We've suggested we increase the level of investment to early intervention, as well as putting investment into primary health care, which we know is absolutely essential, into emergency services, which we know are absolutely essential. We're also suggesting that we have a special commissioner or commission for mental health, because we believe this issue is so significant that it needs it. We also took to the electorate, and we're glad to the election, we're glad the government picked it up, which was putting in place a minister that is responsible for mental health. We think that's a very good step in the right direction. What we need to do now, of course, is see the government's commitment to mental health. We need to see their investment. So we agree with the opposition. We need to significantly increase our investment in mental health. Absolutely no disagreement there. Where we think we need to be very careful is where we increase that level of investment, because we're not going to get to the absolute level of investment that we need over the next 12 months or over the next 2 or 3 years. So we need to be constructing and focusing our investment where it's going to meet the need. Early intervention, absolutely, we have no doubt that that is absolutely critical, but we need to make it take a much more broader approach. Now, yes, there has been a high-profile campaign about early intervention, and that's fantastic because it's focused attention and the public's attention on the need to address mental health. But we cannot just invest in early intervention. And you know what? I've had so many emails, so many phone calls and personal visits saying, please just don't invest in early intervention. Yes, that's essential, but you need all these community services. We need community care services. We need better investment in rural and regional areas. And if you just focus on early intervention, all those other people with all these needs are not going to have their needs met. And we know what happens then. We know people get sicker. We know there's homelessness results out of that. We know there's all sorts of follow-on processes or follow-on events if we don't actually provide the services and support for people that need support through a mental illness. So my plea here is yes to the government, please invest the level of resources we need. The Greens are saying, we went to the elections saying we need at least an investment of $350 million a year. We actually agree with the opposition, it needs to be more. So we've said $450 million a year, but not just on early intervention. But we actually think you can have your cake and eat it too, which is why I beg the opposition to consider our amendments. Because if you look at the costings that have been put forward for the building of headspace and epic centres that it's estimated that we need to phase that in anyway. So we can phase in investment into headspace and epic and early intervention, because there's other methods of early intervention besides headspace and epic. They're very good, but there are others. But we need to invest in younger children. We need to invest in the over 25s. We can do that and invest in these other programs. Because you know what I'm really worried about? Is if we just say early intervention, the government's got to take a ticket to go. They've got a ticket to go, yeah, we've invested in mental health, we've funded a few extra headspace and epic centres, that's it, we've done mental health. And they will not have fixed mental health. So please, let's take a coordinated, comprehensive approach to funding mental health. Invest in the services that are absolutely desperately needed, not just early intervention. But please, I don't want anyone thinking that we don't support early intervention, because we do. But it has to be in a comprehensive approach to mental health funding, not a knee-jerk reaction because it's popular at the moment. We need a much more comprehensive approach, and the government needs to be funding that. So we do agree with that point.